Greetings, everyone. Welcome to the LiftAffect podcast. I am your host, Matt McNeil, founder, clinical director, and director of human performance at LiftAffect, where we assist professional pilots with maintaining better mental health and optimizing their mental skills. The goal of this podcast is simple: to help pilots and other high liability professionals and disciplines come out of the shadows to discover how we can live better lives personally and professionally. Join us each episode as we discuss various topics ranging from mental health, mental skills and performance, to business, entrepreneurship, and a few other surprises along the way.
Welcome, ladies and gentlemen, to another episode of the LiftAffect podcast. I'm your host, Karl Keller, along with the Pain Meister himself, Matt McNeil.
Old man.
Yeah, it's
maybe it's just a sign of getting old.
So tell me, you said you had a little bit of pain, big guy.
Little bit of pain. I was trying to cuddle with my dog.
Dog whisperer too.
Yeah, dog whisperer too. Zoe, I was trying to lay down. She's all, she's all schmoopy, and I was like, oh, let me lay down on the floor with her last night. I'm like, let me just lay down next to her and we'll spoon. And I reached my arm above my head as I'm laying on my side, and I felt something pop on my upper part of my rib cage. And I was like, oh, it hurt. And I was like, did I dislocate a rib or something totally weird? So I think my wife thinks it's just I pulled a muscle and something, the tendons kind of snapped a little bit or whatever. But I'm hurting now. It's just everything hurts on this left side. So sleep was awesome last night, as you can imagine. Anyways,
there you go.
Enough about my ailments. How's your ailments, old man?
Oh my God, they're all there. Actually, we had our annual banquet for our volunteer fire department.
Yeah.
And I do something I haven't done in a long time, which was dance. And,
oh God, is there video?
Hell no. Hell no. No.
Give me your wife's number. I know she's got video somewhere.
Yeah.
Oh my God.
The old saying, white men can't jump. I tell you what,
can't
I can add dance into that list.
But are you sore today?
Oh, yeah. Well,
KK, man, cutting some rug, dude.
Yeah,
awesome,
yeah. Well,
dude.
I was cutting something. My son was getting some food and stuff, so he missed it. But his girlfriend goes, he came back. He goes, "Oh, you should have seen it. He was dancing."
So funny, man.
The way she said it, she's British, and it's I didn't know how to take that, because I didn't think it came across as a compliment.
It wasn't a compliment. Oh my God, he's dancing. Yeah.
Yeah. Get him off the floor now.
Somebody help him. Anyway.
Why are people leaving?
That's pretty funny, man.
But
speaking of dance, let's dance, man. What are we?
Yeah.
We're gonna wrap this thing up, I think.
You're cute. I'm not so much. So I think you and I are not going to be a dancing duo.
Okay. Well, then we'll just do a podcast.
I tell you what, that's probably what people want.
People are here for.
Yeah.
So,
so this is what our third episode of the, and I think final one. I believe this will wrap this one up, or at least right now.
Attention Deficit Hyperactivity Disorder.
Yep. ADHD. Today, I guess we're going to go kind of big picture on what to do when you have it, as far as treatments, meds, effects, those kind of things. So I know you've been digging, and you probably have more than enough stuff probably to do several more episodes, but we're going to kind of let you have at it and talk about those things, because I think that's kind of goes hand in hand with what we've talked about so far. And then I think we may summarize it all at the end.
We'll wrap it up. So in a lot of the questions that have come through, very viewed podcast, this ADHD one is spreading around. So there's a huge interest in it. And some of the subsequent questions, most of them have been, why is the FAA so stupid they don't allow pilots to get help? I can't help you with that. But it's also been about what are the drugs that people use? And I'm holding this up, you can see, there are
A lot.
A lot.
A lot of drugs on
There's
that
a
thing.
ton.
Holy jeez. And I would imagine in some cases, some of them are very similar.
Yeah,
it's
their
kind of like people
mechanisms
when you're
of
treating.
action are different. There's different mechanisms, but there's some of them have some similar properties. Some of them fall into the stimulant category. Some of them are actually antihypertensives that they find are useful for ADHD. So what happened is they discovered in the 70s and 80s they realized, okay, ADHD is a dopamine deficiency because the drugs that they used to manage it that they found worked all they produce increases in dopamine availability in the brain, and they did it through all these different kinds of mechanisms. That's why the drugs have different mechanisms of action. That's how drugs work, and they're all different. They don't do it the same. But the accumulating result is that there's more dopamine in the brain to do the job that it's not doing in people with ADHD. People with ADHD have a depletion or less dopamine than the neurotypical subset of the population that does not have ADHD. But in more recent years, the literature has indicated that they've started to see that norepinephrine, which is related to dopamine, is also implicated in this kind of disorder. And so, like there's a drug called Strattera, which is a ADHD treatment medication, and that is a norepinephrine drug that increases norepinephrine in the brain. So, and then there's things like Quellbri, and again, there's just more drugs than I care. There's like 50 of them that I've, over my research have found. I thought there was like 12 or 13 because that's kind of what I'm just used to seeing. And it's like, there's actually like 50 of them. And so there's dopamine and norepinephrine. And so the question is like, okay, what is happening? And if you want to get into the dorky stuff, there's things called alpha 2 ports, which are they exist in the frontal lobe. And they're like portholes of neurons in the front lobe that they open and close to determine basically how much noise is in the nerve cells. And these alpha 2 ports, which are responsive to alpha 2 drugs, they end up helping ADHD because they fine tune the nerve cells in the executive brain. So again, it's like the bottom structure to the top structure. How do they communicate? And in the ADHD brain, there's a lot of noise on the prefrontal cortex, the higher level functions. And so again, we could go down to rabbit holes that we don't really need to do here. But the point,
in essence, you're kind of saying it calms them down. The noise, it lowers the noise level.
It does. No,
so that both sides can hear each other or connect instead of it just being drowned out.
Right. That's right. So you've got dopamine. That's there's all these different 3 neurotransmitters are involved. There's dopamine, and that's what the stimulants are for. And then there's the norepinephrine, and that's what the non-stimulant drugs are for. And then there's the alpha 2 ports and the noise in the frontal lobe. And that's what the antihypertensive drugs, interestingly, are for, like clonidine and guanfacine, which you'll see a lot of kids get put on these. If sometimes they're a little too young to be put on stimulants. And so they'll use things like clonidine or guanfacine. And so pretty interesting. But it goes, obviously ADHD goes beyond just the neurochemistry because the genes are a factor at play here. And there's 12 genes. And there's a recent study that said they're finding that there's actually more like 45 to 50 genes are involved in ADHD, which is so, it's like, the brain this is why I always say, like, the brain is so complicated. It's this massive ecosystem and framework. And what are your thoughts on all of that?
I think as the testing they get better fidelity and they're able to see more, they're starting to realize how much more there is because now they can actually test for it. A genome test a few years ago would have been 100.
Yeah.
Now it's like 10,000 or something like that. And who knows what it's going to be in 5 years from now. So I think as they're able to get more fidelity, they may find out that 50 is too low too. It's just because, like you say, they all connect. They're all interrelated,
Yeah.
and it unfortunately it's that I guess you would almost the term I always use is law of unintended consequences. You don't realize what the effect from one does on all the others.
That's
And
right.
and I guess in the brain, just a small change is all it may take to throw things off balance. And
Yeah.
then it's a ripple effect. So it's hard to sit there and even begin to imagine, like you say, all the things. The thought that I was getting when you were talking before about the three, you were talking about the different drugs.
Mhm.
My guess is not everybody that has ADHD gets all three. So they're trying to figure
No.
out which one of those
Is
or
gonna
which
respond,
two.
yeah,
Right.
and that's where the gene
So
testing and is gonna be very helpful to know,
to be able
like,
to neck it
to
down.
yeah, to be able to use the right, drug therapy to treat your problem. So, like, in the research, when you look at genes, like, they call the DAT1, which is this dopamine gene. I remember reading about this years ago, but, like, so if you have ADHD, you might have 7 or 8 or 9 copies of this DAT1, whereas the neurotypical person would have 4 or 5. And so it's those extra versions of these genetic mutations that start to just create all sorts of problems with how the brain is built and how it functions. So the point of all this is it's complicated. It's really, really complicated. But let's not be super complicated. Let's dumb this down. So when you go to the doctor, and usually ADHD is diagnosed in the GP's office, which I've tried to make the case to get a real diagnosis, you need to have a full workup, not a 15-minute, I can't concentrate, here's the drugs. But
the GP is basically just to kind of point you in a direction.
well, usually they just try to
probably,
solve it, right? They're like, okay,
but they
try
should
this.
be.
They
should be.
should, but the medical system is not set up for that. I mean, some people don't have insurance to be able to go to a neuropsychologist and get a full workup. That could be $4,000 or $5,000. So, I mean, I understand why this is no cut on GPs. GPs have the hardest job in the world to do.
The G in GP is general.
It's general, and it's also 15 minutes, and they see clients back to back to back to back to back, and so they got to come in and try to figure it out really quickly and make an assessment and come up with a treatment plan. But let's say you've got the resources and you have the funds to get a proper diagnosis. You should really go to a neuropsychologist or even a neuropsychiatrist to get a proper workup. But the drugs, usually they find that stimulants are now. Here's a consideration: how quickly do you need it to work? Is this, I need this fast because, like, the child is so disruptive that they're about to get kicked out of school, which is often what happens? Or is this something that you can sort of slow roll this to try to figure out what's going on? Stimulants are usually the choice because they work much, much faster than the non-stimulant drugs. But then here's another consideration. What if you have an anxiety disorder on top of this? And I'll tell you, as adults, if you've been living with ADHD for a long time, you probably have a co-occurring anxiety disorder that's a result that is absolutely tied into the struggles of ADHD, losing jobs, not being able to perform well in school, having, performance related issues just in your life, relationship problems, so on and so forth. Well, that will give you some anxiety or some depression on top of it. So if there's an anxiety disorder, well, you probably wouldn't want to give somebody a stimulant that's having an anxiety problem.
And the other way around, when someone who's like being depressed.
Right. That's or depressed. Sometimes stimulants can actually help with depression, right? It kind of gives them a little.
I'm just saying the other way around.
It's the other way around. So there's a lot of considerations with what's the proper drug. So, stimulants versus non-stimulants. And then, like if people are having high levels of hyperactive aggression, maybe antihypertensives, which they do for children. They give them antihypertensives. It calms them down. It slows everything down. So good clinicians, they will really think through this. That's why it takes 4 or 5 hours to get the history. What is the history? What's the family history? And so remember, 80% of people with ADHD have a second disorder. That's a statistic. Have one or more second disorders. 50%. I'm sorry, 80% have a second. 50% have two or more of people with ADHD, co-occurring issues. What a good clinician is really having to deal with is like having to deal with disorder combinations, and how do they manage all of those pieces? That's why a very good psychiatrist, once the diagnosis is made, the psychiatrist will be able to help manage what are those different medications that should be administered.
When you talk about they have secondary or tertiary or more underlying, which is there like a hierarchy, an order of which they would be? In other words, would they potentially diagnose the secondary or sub, the lower ones first and miss the ADHD?
Good question.
Example, or would it be the other way around?
I don't know the data on it. I don't know but that's a very good question. I would think it's what is causing what. Sometimes it's a result of something, but
that's kind of what I'm asking as far
as. I know, like, the research shows that in adults, people that are diagnosed with ADHD as an adult, because of what I talked about before, is it's an accumulation of setbacks that creates a lot of anxiety that's been a result of the ADHD. So it's very common for adults that get diagnosed have an anxiety or a depression disorder, a mood disorder on top of the ADHD. For children, but I don't know I don't view them as like hierarchies. I just think like they're just co-occurring. It's like.
So as an example, someone who's showing anxiety and they start looking back and they realize that it could be the ADHD is kind of been causing that.
Yep.
Trying to figure out exactly what's the root cause of something.
Right. That's right. And one of the problems too is that, the stimulants are Schedule II drugs. I mean, these are, and unfortunately they get abused a lot. And so.
And for those that don't know, what is Schedule II?
It means.
This is how I earn my money, with these insightful.
Yeah.
Oh my God.
Schedule II drugs are drugs for a high potential for being abused. And they, leading to severe psychological or physical dependence, high levels of addictive qualities, and they can be abused. So stimulants are something that, unfortunately, in college, kids are on stimulants to like stay up all night, or, I mean, they're snorting them, they're doing all sorts of really bad things with them. So one of the concerns that clinicians have is what is the age and the life space of the person that's they're diagnosing. So if it's a 19-year-old that's in college, a lot of times they're like, you know what, we want to try to avoid the stimulants because we don't want a dependency or an abuse type of situation happening, because it's rampant on college campuses. People are taking ADHD meds when they don't have ADHD, and they're selling them, and you hear all sorts of horror stories. So they've got to be very, very careful. So okay, but let's look at some of the efficacy. Like, so what is the drugs? Now, how do they work? I got to tell you that in terms of psychiatric problems, ADHD drugs are like a miracle for people. They don't work in 8 to 10% of people that try them. They have no effect, or they have an adverse reaction. And so then they got to stop. They can't be on those drugs. But the remaining 90%, so here it is, 55% are completely normalized on the medication, completely back to normal. They hit normal neurotypical, baseline. That is insane. If you know anything about how drugs work, like, that's crazy how well that. I wish depression and anxiety would work like that with the drugs that are available, but not even close. We'll have another podcast on all that, but that is completely normalized. So where they are completely normal compared to everybody else in the population. And the people that have that experience, I have a good friend that's going to come on our podcast that finally got treated. He was a pilot, is a pilot, stopped flying, got treated. And it's like, oh my God, I feel normal. This saved my life. Saved my marriage, saved my relationships. Unfortunately, as a pilot, can't say saved your job, unfortunately. But should. But these are really, that's a huge, very important statistic.
Now, when we were talking about something, and this may be a little bit slightly off topic, it's the one that I keep thinking about is, and it's so much for parents, especially 10, 20 years ago, and that is Ritalin.
Mm.
You know, does Ritalin have that normalizing effect, and was that an overused or overdiagnosed kind of medication based on the fact of the rage everybody was talking about? It was like that was all you
That
heard.
was the drug. Yeah.
And I was just wondering, is that something like that, or is that just kind of fallen out of vogue?
No, I think it's still used. It's still used. Methylphenidate, I think is what the generic is. But yeah, it's still used. It is a stimulant. It's a psychostimulant. So like some of the stimulants are Ritalin, Concerta, Metadate, Methylene, Datrana, or Patch it's called. Focalin,
I haven't heard of any of those except for the
Dexedrine, Vinase,
Wow.
Adderall, another big one.
Now, yeah, I've heard of
Nuvigil. I mean, there's a bunch.
Wow.
There's a bunch. So one of the things I wanted to mention, and that I'm kind of reading about, and this is just in any kind of mental health issue, there's kind of two ways that getting a diagnosis can go. It can be very distressing for people to receive a diagnosis, but it can also be a relief for people. And I think for ADHD, certainly in the literature, is when people get the diagnosis, especially as adults, of ADHD, there is a sense of relief that comes from that, because it's a recognition that it's not my fault. You know, I'm not just lazy and stupid and inconsiderate and a jerk. I didn't choose this. This is a neurodevelopment disorder or disability. And the mindset becomes very therapeutic because it says that you didn't cause this. You have to deal with it, but it's not your fault. It's a real thing. It's not some made up fictitious disorder. It's real.
And also, I would think not like some other ones where once you diagnose, they're still trying to figure out what the path forward for treatment is. There is a very clear series of options for treatment here compared to other things. So once you know, now you can start addressing it.
That's right.
I think would also help.
Yeah, and I mean, certainly with my clients, when they get the diagnosis of ADHD, not from me, but they go get an actual diagnosis, it says, okay, you can alleviate yourself of all that shame, but now you do have to do something about it. You know, you really need to get treated because it's a real thing. And so you don't want to leave that untreated because it's it'll just wreak havoc. One of the questions that somebody sent me was, if I take a medication and it doesn't work, does that mean that I don't have ADHD? No, that's not what that means. So people are like, oh, I tried Ritalin, it didn't work, so I must not have ADHD. Well, we just covered there's all sorts of different mechanisms of action and different your brain is everybody's brain is a little different. So just because a drug didn't work doesn't mean that you don't have ADHD.
And also, a lot of these drugs are not fast acting. It takes a little while for the body to react to it. So
especially the non-stimulant ones. Yeah. So there you have it. That's the meds, but the 55% totally back to normal. What about the other percent? Well, sometimes they get a benefit. It might not be a perfect benefit, but it's a benefit. And only, 5 to 10%, it just doesn't work at all, or they have bad reactions and they have to come off. So pretty compelling.
And that actually leads, and that actually leads into the next question is, and you see it all the time on the TV ads, they talk about stuff that's like fixes my loss of hair growth or
right.
no, whatever. And then when you start listening to the side effects, it's like, holy crap. I think, it's like possible effects, up to and including death, it seems like on some of them. So on the effects, and with this so many, I imagine that there's just a wide range of possible negative or adverse effects. I guess so. That's the question. They take the meds. What are possible side effects or generic?
Here's what I'm going to tell you. I won't go there because, and this is why. One of my really good friends is a psychiatrist. My wife works in adult behavioral health psychiatry. This is what I've been told by the physicians and the NPs and all this stuff. And they know the drug stuff. I'm not the drug guy, but here's what they tell me. And I think this is really good. And I give this advice to my clients all the time, especially the ones that are on medication and they're trying to get used to medication. Any drug is capable of producing any side effect. It's really an N of one. Yes, there are some very typical side effect profiles. And plus a side effect might be you feel better. That could be that is a side effect of a drug. But in terms of negative side effects, any drug can produce any side effect for any. It could be weird, like, it's an N of one. And so you have to work with your physician, the prescriber, hopefully a psychiatrist if you've got ADHD, to kind of figure out what is a side effect of the drug, what is not, how do you manage it, can you work through it, do you need to switch to something else, do you need to change the dose, do they need to add something else to it? But that has been the best advice I've ever been given by a psychiatrist for working with clients is, well, could that be a side effect? Matt, any drug is capable of producing any side effect. So that's how I view side effects. You just have to wait and see, and you have to try it. I don't even want to venture into what could be, because I don't want to discourage people or freak people out from, pursuing pharmacological treatment if that's what they need. But any drug is capable of producing any side effect. You just have to wait and see.
There you have it.
There you have it. So should we sum this up? How much time we got?
I had a separate question.
Okay.
Because I'm dealing with this with a totally different issue, and that is what impact, or should I? And this could go any way you want to go. This could be either the impact of or the lack of food, certain kinds of food, that kind of stuff. Because some, they say you're not getting enough of a certain type of nutrition, or what is the impact of eating certain types of food, or just general? I'm just going to throw it out as a big one, because you could look at it either way. Too much of something, not enough of something. So
there's different programs, and you can go and you got to be very careful of the snake oil out there on the internet about the ADHD diet and this and that, and yada yada. Here's what I know. There's current evidence that the gut microbiome and ADHD pathophysiology and therapeutic implications. There is evidence that it matters. What is in your gut biome? But that is like, we're light years away, I think. Well, we're not light years away, but there's a lot of work to be done in that area, because the gut biome, if you think about this, neurotransmitters, these are kind of what makes us feel how we feel in our head. Like 80% of neurotransmitters are manufactured in the gut biome. That, don't quote me, okay? I don't know if that 80%, but it's a large majority are produced in the gut microbiome as opposed to the head. That's so, trust your gut and all that stuff. You and I laugh about that because in business that usually means gave up thinking. But in honesty, there is good evidence that your gut has a lot of intelligence, because there's neurotransmitters being manufactured in there. There's like second brain as your gut. So there is something about the gut that that matters. But the research shows that about 5 to 8% of folks with ADHD may have sensitivity to things like, here's the big one, like food colors, artificial food colors. That's the big one. Don't do the red dye, or that cause ADHD. Pretty weak evidence about that. But 5 to 8% of people with ADHD may have sensitivities to those things. Could that be confounding? Could there be other variables? Absolutely, there could be.
How about food groups?
Yeah, well, I mean, so it seems like just the biggest problem in medicine, whether it's ADHD or depression or anxiety, and in fact, let me grab a book. Hold on.
And let me tell you, all the books behind Matt's head, if you were to see this visually, he uses every one of those. They're not sitting there for show. No. It's amazing. Because he's constantly pulling them out, and I'm going, oh my God, How did you know where everything
Whatever. I
was?
can't find it. Yeah, I can't find it. There's a great book on that just came out by a Harvard psychiatrist on sort of using food to treat mental health issues. Quick side note, I found the book. It's called Brain Energy. I can't believe I couldn't remember that, but it's Brain Energy by Chris Palmer, MD. The subtitle is A Revolutionary Breakthrough in Understanding Mental Health and Improving Treatment for Anxiety, Depression, OCD, PTSD, and more. Chris Palmer is a Harvard psychiatrist and researcher working in the interface between metabolism and mental health. He's the director of the Department of Postgraduate and Continuing Education at McLean Hospital and an assistant professor of psychiatry at Harvard Medical School. And for a couple decades, he's held leadership position roles in psychiatric education at Harvard, McLean Hospital, and nationally. He spent 15 years conducting neuroscience research in the areas of substance use and sleep disorders. And on top of his academic pursuits, he's continued to practice psychiatry, working with people who have treatment-resistant mental disorders using a variety of standard treatments. It's pretty rare for a researcher to also be actually in clinic. So the guy does both. And he's really been pioneering the use of the medical ketogenic diet in the treatment of psychiatric disorders, conducting research in this area, treating patients, publishing academic articles, and speaking globally on the topic. And most recently, he's developed the first comprehensive theory of what causes mental illness, integrating biological, psychological, and social research into one unifying theory, the brain energy theory of mental illness. So that's just kind of from his book that came out last year, Brain Energy. Chris Palmer, highly recommend you check it out if you want to dork out and get deep into this stuff. So back to the my conversation with Karl. Here's like the problem in just medicine in general is inflammation. Inflammation is responsible for almost every medical disorder that the human can have, is in an inflammatory process. So foods that reduce inflammation are key. And even in ADHD, inflammation is a problem. So anti-inflammatory foods, and so what's the number one thing that causes inflammation? Sugar, refined sugar, processed sugar, and even too much fruit, too much glucose. You can't, you got to be careful with that. So sugars is one. Oil, believe it or not, there's bad oil in everything and how it's cooked. And, some oil, like olive oil, when you heat it up, it actually becomes toxic. Oils is another problem. And just, things that turn into sugar. Garbage is garbage in many respects. So I would say that it just says anti-inflammatory diet. It helps not just ADHD, but helps everything.
The number of people that I keep hearing that have IBS is just keeps going up and up. So
it's skyrocketed. The Feingold program. That's what it was. There was a diet called the Feingold program. And basically it, just kind of, it eliminates artificial colors and flavors, sweeteners, preservatives, but not a lot of the research can be replicated, which means not super solid, not solid, so I just think the anti-inflammatory, approach is only going to benefit everything, everything in your life. But it's pretty weak in terms of a specific ADHD protocol diet. It's just not there yet. There's not enough in the research. One thing I did want to talk about was I got some questions about what's the difference between ADHD and anxiety, and ADHD and depression.
Even though those could be secondary or...
Yeah, they could be, co-occurring with it. So if you think about ADHD is when you're extremely distracted. That's what ADHD is. So, you're kind of skipping from one thing to another, and you're getting pulled in various directions, with distractions. And so the researchers say they consider being overly coupled to the environment and not coupled enough to mental information about, the lists of things that they need to do and what are the goals and so on and so forth. what they need to do today. And so they're not governed by mental information the way that neurotypical people are. And so it's kind of like there's an interesting thing about, they say, there's two types of time in ADHD world, now and not now. And so it's, these people are governed by context in the now. So that's what ADHD is. So then if you look at like anxiety and depression, it's the opposite. People are overly coupled to mental information, ruminating, fear, obsessing, anticipation, worry. And then they're inattentive to what's actually happening in the external world. It's like all internal versus external, and ADHD is like all external versus internal. So they're opposite directions. Does that kind of make sense?
Yeah.
You think about it?
I was just thinking, you always talk about being present in the moment.
Right.
It sounds like ADHD people are in the moment.
Well, yes,
Kind of.
but even mindfulness training, which is another treatment, which I didn't mention, is the behavioral treatments. We talked about drugs, then there's behavioral treatments, and mindfulness-based treatments are shown to be efficacious for ADHD. So, yeah, I mean, I think it's one is like, what is your relationship to the world, to the external world, and to your internal world? And so the anxiety and depression kind of run one way, and ADHD runs the opposite way. So which way are you coupled is really a good way to think about that. The ADHD people, they're not really in their head that much. And it's usually because their ideas are just sort of skipping all over the place. Whereas when you're depressed and you're anxious, for our listeners that can relate to that, you're way in your head. Like you're completely in your head. So that's kind of the difference between it. But remember, these things are coexisting disorders, and when you're in your, I think it's the research showed that by the time you're in your 30s, if you have undiagnosed ADHD, 35 to 50% have developed an anxiety disorder as a result of it. So that's the skinny on the difference between. So now, let's sum it up. So okay. I'm worried that I might have ADHD, or I'm worried that maybe one of my loved ones, my child, my partner, whatever, might have ADHD. What do I do? Well, be sensitive if you're going to bring it up, right? I mean, it's a serious thing, but here's the steps that you should follow. One is you need to get a proper diagnosis. So I've tried to beat that into everybody's head here. You need to go to a specialist. Don't just go for a 15-minute appointment and get a diagnosis, or do a 10-minute. There's all these online things now where you can get a diagnosis in 10 minutes, and which is crazy to me. Like, get a proper diagnosis if you have the resources to do it. Second is, just because you get a diagnosis isn't the end, right? You need to educate yourself. We see this in our practice all the time. When you educate people and you encourage them to read, to watch lectures, there's all sorts of great YouTube references. Dr. Barclay, who I mentioned last time, he's got a great YouTube channel, tons of stuff on there. Hollowell's got stuff on there. I mean, there's so much good stuff on ADHD. Sift through the bad stuff, go to the reputable stuff, but you can get a whole education on this. You really need to educate yourself. There's different websites like ADD.org, World Federation for ADHD. There's CHADD, CHADD, which is organization in Canada, and CADRO, and National Institute of Health. Like, there's really good resources on there that you can start to educate yourself. So get a diagnosis, you got to educate yourself. Third step, honestly, the research shows medication, of all the treatments, the most effective, hands down. Whether you like it or not, whether you agree with meds, you're anti-med, you're pro-med, doesn't really matter, right? Opinions don't really matter. The data matters. Meds, it's 3 times better than anything else out there, is medication. It just works. Meds. Next step, and for the medication piece, Dr. Barclay always says ADHD it's like the diabetes of psychiatry. If you had diabetes, would you not take insulin? Not a good outcome. It's the same with ADHD. Next step, so you get evaluated, you got educated, you got medication. then the next step is you have to start to modify. What can you do to modify your behaviors in order to be able to cope better with the demands that having ADHD puts on you? And that's where things like cognitive behavioral therapy, ACT, acceptance and commitment, mindfulness-based approaches are very, very helpful practices, particularly mindfulness for adults with ADHD. And then the last step is accommodations. So how can I physically change my environment so that my disorder it's still there, but it's not, crushing me? Things like activity, daily calendar. Use an actual calendar instead of 1,000 sticky notes. Put it into one place. There's different apps that help people with ADHD organize their time, having reminders, I don't have ADHD, but still a lot of my clients do, productivity planner. I'm holding this up, right? What's my one most important task that I have to do today? What's my secondary? What's my additional? Plan tomorrow, today. Don't wake up and go, okay, what do I need to do? Set your agenda aside for tomorrow. So when you get up, you know exactly what you have to do. And you're not trying to spend all this time running around figuring out what to do, what you need to do. So you got to be able to modify your behavior. So get a proper diagnosis, educate yourself with the amazing stuff that's out there for free. Get the medication if you need it. A good evaluation will help steer you in that direction. Modify your behavior, and then make some accommodations so that you can support yourself through the process. And that is, my friends, is really, I think, the quick and dirty, but hopefully useful information and approach to managing attention deficit hyperactivity disorder.
That, ladies and gentlemen, was like you say, a quick 3-part podcast version. And I can guarantee you, based on all the notes that I saw that Matt had, we could do a lot more. It's just that there's so many other things that we want to cover. We appreciate all of the comments that came in because that helped kind of fine-tune some of the things to really talk about. So if you have any comments, please send them to podcast@liftaffect.com because they do help kind of steer what we talk about and even within topics, what areas within the topic. So please keep them coming. Please smash the like, tell your friends about it. The word of mouth is getting out there and people are coming to our podcast to listen to the different things that we discuss. It's mental health and mental skills. Also, no matter which playlist you're on, in the description, there are 2 links. One is for our premium content that gives you additional information, show notes, and actual interviews. I should say book reviews and interviews with people. And also, there's another link for a free newsletter that you get weekly. Also, just as a note on our premium content channel, that's how we generate any additional, that's how you can help us because we don't ask for anything, no donations or contributions. This is our way of getting you to help us keep this content coming in. So if you love what we do, please consider going to our premium content channel because that's where you can help us and also get additional information. We appreciate it. As best as I can say, we love you because you're the reason we do this, and without you, we wouldn't be here. And we thank you, and we look forward to seeing you on our next podcast. Until then, have a great day and a great week.
Thank you for listening to this week's episode of the LiftAffect podcast. If you want to dive deeper into this episode and every episode, go to our website, liftaffect.com/podcast. If you're enjoying the show, we would love it if you'd follow us on Spotify and rate, review, and subscribe on Apple Podcasts. We really appreciate your support. You can find me on Facebook, Instagram, and LinkedIn, all with the ID Matthew McNeil. This show is brought to you by LiftAffect. a clinical mental health and consulting company that assists air carriers, corporate flight departments, pilot unions, and commercial pilots by providing comprehensive psychotherapy and mental skills coaching services to pilots with mental health and mental performance-related issues. Visit LiftAffect.com, that's LiftAffect.com, to book your free consultation. And finally, this podcast is for general informational purposes only. It does not constitute the practice of counseling, psychotherapy, medicine, or any other healthcare service, including the giving of medical advice. No therapeutic or provider-patient relationship is formed. The use of this information and any materials linked to this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional psychological advice, diagnosis, or treatment. Users should not disregard or delay in obtaining advice for any psychological or medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. Thanks for tuning in, and we'll see you next time on the LiftAffect podcast.